A very good morning to one and all who have joined us today morning for our initiative, Tell Me More, Know More About Your Heart Health. As we know that World Heart Day is celebrated every year on 29 September with an objective to raise awareness about the rising concerns of heart health and cardiovascular diseases and the ways to prevent and treat the same. This year campaign focuses on the essential step on knowing about our heart first. The campaign is known as Use Your Heart to Know Your Heart. Because as we know that the more we know about the heart, the better we can take care. हमारे साथ कुछ दर्शक ऐसे भी जुड़े जो हिंदी ज्यादा बेहतर समझते हैं, तो उनके लिए मैं कुछ शेयर करना चाहूंगी। हर साल 29 सितंबर को वर्ल्ड हार्ट डे मनाया जाता है। इस वर्ष का थीम है यूज हार्ट टू नो हार्ट, जो हमें याद दिलाती है कि हमें अपने दिल का स्वास्थ्य खुद रखना चाहिए। तो इस ओकेशन पर, ऑन द ओकेशन ऑफ वर्ल्ड हार्ट डे, we have with us Dr. Sachin Chaudhary, who is a consultant and interventional cardiologist based at Mumbai, who would lead this initiative of Tell Me More to know more about your heart health and guide the general public and the patients about heart diseases, how we can prevent it, and what necessary steps we can take in our day-to-day life to cure it. Thank you so much. So now I would like to hand over the session to Dr. Sachin Chaudhary, our clinical expert for today. Sir, over to you.
Good morning, everyone. Thanks for the kind introduction. The heart problem scenario in our country and has changed very rapidly over last 10 years or so. So heart attack was supposed to be a problem of elderly age, which used to see majority patient above 60 years of age. Now this age for heart attack and heart disease has drastically shifted to lower. The maximum patients, the bulk of patients we are seeing with heart attack are now between 30 to 50 years of age. And this is a worrying trend. And this trend is following the increased number of young hypertensive and increased number of young diabetic patients. So in short, more and more patients are getting diagnosed with hypertension and diabetes at earlier age than before, and this in turn is getting translated into the increased risk of heart disease. So this is like an epidemic of heart disease in the recent times, which we have observed during COVID and post-COVID times also. So what can be done to prevent this catastrophic disease? See, there are two scenarios. Two things: how we should prevent this disease and what should we do when this happens. So in the first part, any stress, either it is physical stress or mental stress, it will have similar kind of effect on your heart. Basically, it will increase the heart rate, and any sudden increase in heart rate can theoretically cause heart attack. Heart attack means there will be sudden closure of the artery of the heart with stopping the blood flow to the heart. And this is the very dramatic presenting disease patient. And many times what happens that a patient will not have very typical symptom also. Like we see on the TV, the severe left-sided chest pain, we see hardly in 30% of the cases. So any new symptoms, most commonly it is confused with the acidity or gas. So any new symptoms which is severe and which was not there present, something like indigestion and acidity-like sensation, so we should try to seek the treatment and try to rule out whether there is no cardiac problem. As I said, to negate the effect of stress on the heart, our heart should have heart should be conditioned. Heart should have some habit of this stress, and for that conditioning there should be a regular activity of 15 to 20 minutes, 10 to 15 minutes of slow walk, and at least 5 minutes of brisk walk. This small change in our lifestyle can go a long way in helping the heart and preventing the heart disease. after the physical and mental stress, usually it comes the lifestyle, the food habits, where our food habits are dramatically changed. We can see the fast food joints at every corner in the nooks and the corners of the city. So we should eat healthy and we should exercise regularly. We should stay away from the addiction like smoking and alcohol. No amount of addiction, no amount of cigarette or no amount of alcohol is safe. So most of the time patients will be like, I'm just having one cigarette a day, but it's not safe. We should stay away from all this addiction, especially in these current times when we are seeing this sudden increase in the heart problems. And third most important thing is we should ensure adequate sleep. Sleep is the best medicine, best cure for your hypertension, and a good sleep can keep you away from the hypertension and diabetes as well. So these are the things, especially those patients who are already diabetic and those who have got family history of a heart problem. There are patients like their parents having heart disease. They should consult doctor at least at or around the age of 40, and they should undergo annual or preventive checkup, something like an echocardiogram or stress test, but strictly after consulting with the doctor. So these are the small things which we can do for prevention of the heart disease. Second part, I would like to emphasize, if this chest pain occurs to some patients, so the emphasis should be on the immediate and early therapy. So basically, a patient should be treated by a cardiologist. First, the diagnosis should be confirmed after doing ECG, and whenever possible, try to salvage the situation by doing the emergency angiography and angioplasty if it is indicated and if it is told by the cardiologist. There is a lot of ignorance about this treatment strategies for the heart attack in the general public. So heart attack is the only situation where there is an urgency and where cardiologists will press you to go ahead with the early angiography and angioplasty. If you are undergoing an elective angiography and angioplasty, in that elective scenario, you can take some time, but when there is a heart attack and you are undergoing emergency angiography, you should follow the doctor's advice, and there should not be undue delay, because time is muscle. That's what we say. If we waste more time, there will be long-term damage to the heart, which we won't be recover even after giving medicine for a whole life. So we need to change our routine to incorporate good food, to do regular exercise, and if at all there is some problem, we should seek an early treatment from the cardiologist to prevent long-term complications of the heart. Thank you.
Thank you so much, sir, for an insightful talk and a very comprehensive deliberation. One message, sir, on the occasion of World Heart Day that you would like to give the general public?
To keep it simple, I will say a happy heart is a healthy heart. So we should try to remain stress-free. We should try to find joy in the small things, and that will help us in a long way to keep our heart healthy.
Thank you so much, sir. I will take this opportunity to conclude the session and propose a vote of thanks to you. Sir, on behalf of the entire team of Saffron, I would like to thank the audience who have joined in, and also Dr. Sachin Chaudhary, who took us time to guide the audience about the very important cardiovascular diseases and how to take care and keep your heart healthy. So thank you so much for everyone who have joined us. For the information of general public, we have kept the live session recorded, as well as we will be posting this on YouTube as well as on Instagram channels. So please, if you have any queries, you can post it over there. Thank you so much once again. Thanks a lot.